Ever met someone whose courage to speak their darkest truth saved not just their own life, but became a beacon of hope for thousands of others drowning in the same silence? These aren't just survivors. They're warriors who chose to transform their deepest pain into healing light for an entire community that desperately needed to know they weren't alone in their struggles. In a world where gay men are 4 times more likely to attempt suicide and face double the risk of depression and anxiety compared to their heterosexual counterparts, these 5 champions decided that silence was more dangerous than vulnerability, and their authentic courage has literally saved lives while revolutionizing how we talk about mental health in the LGBTQ+ community. Welcome back to Rainbow Spotlight. Today we're honoring the top 5 gay male mental health warriors whose 2024 to 2025 advocacy has shattered stigma, challenged toxic masculinity, and created safe spaces where struggling men can finally admit they're not okay without losing their identity, their community, or their hope for healing. These aren't just mental health advocates. They're lifesavers who understand that authentic vulnerability requires more courage than any battle. And their willingness to share their darkest moments has created light for others who thought they would never see dawn again. From therapists who rebuilt their own lives to social media advocates turning pain into purpose, these warriors represent the beautiful truth that healing multiplies when shared authentically. Each story demonstrates that the most powerful form of activism often emerges when people choose to transform personal trauma into collective healing, while proving that seeking help isn't weakness. It's the most courageous thing a man can do in a culture that demands silence about suffering. Healing Warrior Confession. Have you ever been saved by someone else's courage to speak honestly about mental health struggles? Or has sharing your own story helped heal others? Drop your experience below. Every vulnerability creates space for healing. Rahim Thawar, the Muslim psychotherapist healing intersectional trauma through authentic representation. When Canadian psychotherapist Rahim Thawar published The Mental Health Guide for Cis and Trans Queer Guys in 2025 while openly discussing his identity as a queer Muslim social worker who survived his own mental health crisis, he didn't just write another self-help book. He created a revolutionary resource that proves healing happens when we stop hiding the intersections of our identity that make us feel most isolated and vulnerable. His courage to be the first openly queer Muslim mental health professional to address the unique challenges facing LGBTQ+ men of color has literally saved lives while demonstrating that representation in healing spaces can mean the difference between despair and hope for marginalized communities who rarely see themselves reflected in traditional mental health resources. What makes Rahim absolutely essential for contemporary LGBTQ+ mental health isn't just his professional expertise, though his dual perspective as both therapist and lived experience survivor creates content that serves both clinical accuracy and authentic relatability that many struggling men desperately need. It's his complete refusal to separate his Muslim faith from his queer identity while providing mental health guidance, demonstrating how religious LGBTQ+ individuals can find healing without abandoning the spiritual aspects of their identity that provide meaning and cultural connection, even when religious communities have been sources of trauma or rejection. His therapeutic approach includes addressing internalized homophobia within religious contexts, helping queer men of color navigate family expectations while maintaining authentic self-expression, and providing culturally competent therapy that honors both LGBTQ+ identity and diverse cultural backgrounds through treatment methods that acknowledge the unique challenges facing intersectional identities in mental health recovery and authentic self-acceptance. The book content addresses specific challenges including coming out within religious families, managing rejection from cultural communities, navigating dating and relationships as queer men of color, and developing resilience against minority stress that compounds mental health challenges for individuals facing multiple forms of discrimination and cultural conflict that can complicate traditional therapeutic approaches. His clinical practice includes training other therapists in LGBTQ+ affirmative care, supervising mental health professionals seeking cultural competence, and providing consultation for organizations wanting to create genuinely inclusive mental health services rather than superficial diversity initiatives that might not address the real barriers preventing LGBTQ+ men from seeking appropriate mental health care and authentic therapeutic support. The cultural impact extends beyond individual therapy into broader conversation about how mental health professionals can serve diverse LGBTQ+ communities, while acknowledging that one-size-fits-all approaches often fail marginalized individuals who need culturally competent care that honors their complete identity, rather than just addressing sexual orientation without considering other aspects of identity that affect mental health. His advocacy work includes educating religious communities about LGBTQ+ mental health, providing resources for families navigating acceptance, and creating bridges between faith communities and LGBTQ+ advocacy organizations that demonstrate how spiritual practice and queer identity can coexist beautifully when approached with genuine understanding and authentic love, rather than conditional acceptance based on identity suppression. For contemporary LGBTQ+ mental health advocacy, Rahim represents breakthrough integration of cultural competence with clinical expertise, while demonstrating how intersectional identity acknowledgement can enhance rather than complicate mental health treatment when approached with genuine understanding and authentic commitment to serving diverse community needs through culturally responsive therapeutic practice and authentic representation. Intersectional healing. Has Rahim Thawar's integration of queer identity with religious background inspired your understanding of how authentic healing must honor complete identity rather than requiring people to hide aspects of themselves? Comment. Healing for appreciate intersectional mental health approach. Representation for value seeing diverse LGBTQ+ therapists in mental health field. Matt Bernstein, the social media educator turning Instagram into mental health sanctuary. When political activist and educator Matt Bernstein began sharing his personal therapy journey, anxiety management techniques, and honest discussions about gay male mental health through his Instagram platform in 2024 to 2025, he transformed social media from performative highlight reel into genuine mental health resource, while proving that authentic vulnerability on public platforms can create healing communities rather than just engagement metrics. His courage to discuss panic attacks, therapy sessions, and medication management while maintaining his political advocacy has created safe digital space where over 800,000 followers can access mental health education that might otherwise be unavailable due to financial, geographic, or cultural barriers that prevent many gay men from seeking traditional mental health care. What makes Matt absolutely revolutionary for digital mental health advocacy isn't just his obvious social media influence, though his ability to reach hundreds of thousands of young LGBTQ+ people with authentic mental health content provides crucial accessibility for communities often excluded from traditional therapeutic resources due to cost, location, or discriminatory healthcare systems. It's his sophisticated integration of political awareness with personal healing that demonstrates how social justice advocacy and individual mental health recovery can enhance rather than compete with each other when approached with genuine understanding and authentic commitment to both personal and collective healing. His content creation includes practical anxiety management techniques, honest therapy session debriefs, and authentic discussion about medication benefits that normalizes mental health treatment while providing educational resources that help followers understand treatment options and reduce stigma around professional mental health care that might otherwise prevent struggling individuals from seeking appropriate support and authentic healing opportunities. The educational approach includes collaborating with licensed therapists, sharing evidence-based mental health information, and providing resource lists for affordable therapy options that demonstrate how social media influencers can use their platforms for genuine community service rather than just personal branding or commercial exploitation of vulnerable audiences seeking authentic mental health guidance and practical support resources. His vulnerability modeling includes honest discussion about therapy challenges, authentic sharing of difficult mental health days, and genuine celebration of healing progress that creates realistic expectations for recovery while providing hope for followers who might otherwise feel isolated in their mental health struggles or discouraged by perfectionist recovery narratives that don't acknowledge the genuine difficulty and ongoing nature of mental health healing. The community-building aspect includes mental health check-ins, follower resource sharing, and genuine engagement with audience mental health questions that creates supportive digital environment where LGBTQ+ individuals can access peer support and practical guidance while maintaining appropriate boundaries and realistic expectations about social media's role in comprehensive mental health care. His influence on digital mental health advocacy includes promoting authentic vulnerability, evidence-based resource sharing, and genuine community care that demonstrates how social media platforms can serve meaningful mental health education and support when approached with authentic intention and appropriate professional consultation rather than replacing comprehensive therapeutic care. For contemporary digital mental health culture, Matt represents successful integration of social media influence with genuine mental health advocacy, while demonstrating how authentic vulnerability and educational content can create meaningful community support and practical resource accessibility for marginalized communities seeking mental health guidance and authentic healing opportunities. Digital Sanctuary. Has Matt Bernstein's authentic approach to sharing mental health content on social media inspired your understanding of how digital platforms can create genuine healing communities? Vote. Healing for social media can support mental health when used authentically. Resource for appreciate accessible mental health education through digital platforms. Trevor Project Leadership Team. The Crisis Intervention Heroes, saving lives every single day. When the Trevor Project released their groundbreaking 2024 national survey revealing that LGBTQ+ young people who have access to affirming spaces report significantly lower suicide attempt rates, the organization's leadership team, including CEO James Black and other key advocates, didn't just publish statistics. They mobilized an entire movement that has directly prevented thousands of suicides while providing 24/7 crisis support for LGBTQ+ youth facing life-threatening mental health crises. Their collective courage to address the reality that LGBTQ+ young people attempt suicide at rates 4 times higher than their heterosexual peers has created the most comprehensive suicide prevention network in LGBTQ+ history, while proving that authentic community support can literally mean the difference between life and death for struggling youth who have nowhere else to turn. What makes the Trevor Project leadership absolutely heroic for LGBTQ+ mental health isn't just their obvious organizational success, though operating the only nationwide 24/7 crisis intervention service specifically for LGBTQ+ youth demonstrates exceptional logistical competence and genuine commitment to life-saving work that requires both professional excellence and authentic emotional resilience from staff members who handle the most critical mental health emergencies. It's their complete dedication to evidence-based suicide prevention research that informs both crisis intervention practices and broader cultural advocacy for LGBTQ+ youth acceptance and authentic community support systems. Their research methodology includes surveying over 18,000 LGBTQ+ young people annually to understand mental health trends, suicide risk factors, and effective intervention strategies that provide crucial data for improving crisis response while educating policymakers, educators, and families about evidence-based approaches to supporting LGBTQ+ youth mental health and preventing suicide through authentic acceptance and genuine community building. The crisis intervention services include trained counselors available 24/7 through phone, text, and chat platforms who provide immediate support during suicidal crises while connecting individuals with ongoing mental health resources and community support that can sustain recovery and authentic healing beyond the immediate crisis intervention through comprehensive follow-up care and resource coordination. Their advocacy work includes educating schools about LGBTQ+ inclusive policies, training healthcare providers in affirmative care practices, and providing resources for families learning to support LGBTQ+ children through genuine acceptance and authentic love that creates protective factors against suicide risk and mental health crisis while building resilient community support systems. The policy impact includes lobbying against discriminatory legislation that increases suicide risk among LGBTQ+ youth, supporting affirming school policies, and advocating for healthcare access that reduces barriers to mental health treatment while creating systematic change that protects vulnerable youth from institutional discrimination and cultural rejection that can trigger mental health crises. Their staff development includes comprehensive training in LGBTQ+ cultural competence, trauma-informed crisis intervention, and self-care practices that prevent burnout while maintaining the emotional resilience necessary for life-saving work that requires exceptional professional skill and authentic personal commitment to serving communities facing life-threatening mental health challenges. For contemporary suicide prevention and LGBTQ plus mental health advocacy, the Trevor Project leadership represents gold standard integration of research, crisis intervention, and cultural advocacy that demonstrates how comprehensive organizational commitment can create systematic change while providing immediate life-saving support for individuals facing mental health crises and authentic community connection. Life-Saving Heroes. Has the Trevor Project's comprehensive approach to suicide prevention inspired your understanding of how organized advocacy can create both immediate crisis support and long-term cultural change? Comment Heroes. For appreciate their life-saving crisis work, systematic for value their research and policy advocacy for LGBTQ plus mental health. Cameron Esposito, the comedian healing trauma through radical honesty and humor. When comedian Cameron Esposito began incorporating discussions about sexual assault recovery, therapy benefits, and LGBTQ plus mental health challenges into his stand-up comedy in 2024 to 2025. While maintaining genuine humor that helps audiences process difficult topics, he revolutionized how entertainment can serve therapeutic purposes while proving that laughter and healing can coexist beautifully when approached with authentic vulnerability and genuine commitment to creating safe spaces for processing trauma. His courage to discuss his own sexual assault survival and mental health recovery through comedy has created unique healing opportunity where audiences can laugh and cry simultaneously while feeling less alone in their struggles with trauma, identity, and authentic self-acceptance through shared experience and genuine community connection. What makes Cameron absolutely groundbreaking for trauma recovery and mental health advocacy isn't just his obvious comedic talent, though his ability to find genuine humor in painful experiences while maintaining respect for trauma survivors demonstrates exceptional skill and authentic commitment to healing that serves both entertainment and therapeutic purposes through carefully crafted content that honors both laughter and pain. It's his sophisticated understanding of how comedy can serve trauma processing and community healing when approached with appropriate sensitivity and genuine intention to create connection rather than exploit pain for entertainment value. His comedy content includes honest discussion about therapy experiences, authentic sharing of recovery challenges, and genuine celebration of healing progress that normalizes mental health treatment while providing educational information about trauma recovery through accessible entertainment format that might reach audiences who wouldn't otherwise engage with traditional mental health resources or therapeutic content. The performance approach includes creating safe spaces at comedy shows, providing content warnings for sensitive material, and maintaining appropriate balance between humor and gravity that allows audiences to laugh while processing difficult emotions through shared experience and genuine community connection that demonstrates how entertainment can serve healing purposes when approached with authentic care and genuine respect for audience emotional needs. His advocacy work includes fundraising for sexual assault prevention organizations, promoting mental health awareness, and using platform influence to support trauma survivors through resource sharing and authentic visibility that demonstrates how public figures can use their success for meaningful community service rather than just personal advancement or commercial exploitation. The therapeutic comedy innovation includes collaborating with mental health professionals, incorporating evidence-based trauma recovery information, and providing resources for audience members who might be triggered by content while creating entertainment that serves both healing and humor through thoughtful content creation and authentic community building that honors both laughter and pain. His influence on comedy industry standards includes promoting trauma-informed entertainment, advocating for audience safety measures, and demonstrating how comedians can address serious topics without exploiting trauma while creating meaningful healing opportunities through authentic vulnerability and genuine commitment to community welfare rather than just personal entertainment career advancement. For contemporary trauma recovery and entertainment industry social responsibility, Cameron represents innovative integration of comedy with healing advocacy while demonstrating how authentic vulnerability and genuine humor can create therapeutic community experiences that serve both entertainment and mental health support through carefully crafted content and genuine commitment to audience well-being. Healing humor. Has Cameron Esposito's approach to using comedy for trauma recovery inspired your understanding of how entertainment can serve genuine healing purposes while maintaining authentic humor? Comment. Healing for comedy can support mental health recovery. Innovative for appreciate new approaches to trauma processing through entertainment. Dr. Jack Drescher, the psychiatrist who revolutionized professional mental health standards for LGBTQ+ communities. When psychiatrist Dr. Jack Drescher led efforts to remove homosexuality from psychiatric diagnostic manuals and continues advocating for LGBTQ+ affirmative mental health practices in 2024 to 2025, he has spent decades transforming mental health profession from source of discrimination into healing resource, while proving that authentic allyship within professional medical communities can literally reshape how entire fields approach marginalized populations. His courage to challenge established psychiatric practices that pathologized LGBTQ+ identities has directly influenced how thousands of mental health professionals provide care while creating training standards that ensure future therapists understand sexual orientation and gender identity as natural human variations rather than mental health disorders requiring conversion or suppression. What makes Dr. Drescher absolutely transformative for professional mental health standards isn't just his academic credentials, though his leadership in major psychiatric organizations and extensive research publications provide credibility and institutional influence that validates LGBTQ+ affirmative practices within professional medical communities that might otherwise resist change. It's his complete commitment to challenging discriminatory practices within his own profession while training other mental health professionals to provide genuinely inclusive care that honors rather than pathologizes LGBTQ+ identities through evidence-based practice and authentic cultural competence. His professional development work includes creating training curricula for mental health professionals, establishing clinical guidelines for LGBTQ+ affirmative therapy, and providing continuing education that ensures practicing therapists understand current research about sexual orientation and gender identity while developing skills for providing culturally competent care that serves diverse LGBTQ+ communities through authentic understanding rather than assumptions or stereotypes. The research contributions include publishing extensively on LGBTQ+ mental health, conducting studies on conversion therapy harm, and documenting the benefits of affirmative therapeutic approaches that provide evidence base for professional practice standards while challenging discriminatory treatment methods that might damage rather than support LGBTQ+ clients seeking authentic mental health care and genuine therapeutic healing. His advocacy within professional organizations includes serving on committees that establish ethical guidelines, reviewing training standards for cultural competence, and promoting research funding for LGBTQ+ mental health studies that ensure professional development keeps pace with contemporary understanding about diverse sexual orientation and gender identity while creating institutional support for inclusive practice standards. The clinical supervision work includes training other psychiatrists and therapists in LGBTQ+ affirmative practices, reviewing treatment approaches for cultural competence, and providing consultation for professionals seeking to improve their service to LGBTQ+ clients through genuine understanding and authentic therapeutic relationship building that honors, rather than challenges, client identity. His influence on mental health education includes developing curriculum standards for training programs, creating competency requirements for professional certification, and advocating for admission policies that ensure diverse representation in mental health fields while building professional pipeline that can serve LGBTQ+ communities through authentic understanding and genuine cultural competence. For contemporary mental health profession development and LGBTQ+ care standards, Dr. Drescher represents ideal integration of professional expertise with social justice advocacy while demonstrating how individual professionals can create systematic change within established institutions through sustained commitment and authentic dedication to serving marginalized communities with genuine respect and evidence-based care. Professional revolution. Has Dr. Drescher's work to transform psychiatric standards inspired your understanding of how individual professionals can create systematic change that benefits entire marginalized communities? Vote Systematic for Appreciate Institutional Change Advocacy, Professional for Value Evidence-Based, LGBTQ plus Affirmative Mental Health Care. From Raheem Thawer's Intersectional Therapeutic Revolution to Matt Bernstein's Digital Mental Health Sanctuary. From the Trevor Project's Life-Saving Crisis Intervention to Dr. Drescher's Professional Standard Transformation and Cameron Esposito's Trauma Healing Comedy Innovation. These 5 warriors prove that the most powerful mental health advocacy happens when people transform their deepest pain into healing light for others while creating communities where vulnerability becomes strength and seeking help becomes an act of courage rather than admission of failure. Time to honor mental health warriors. First, which warrior's approach to breaking mental health silence has most profoundly impacted your own healing journey or inspired your understanding of how authentic vulnerability can create life-saving community connections? Drop your number 1 through 5. We need to know whose courage has literally saved lives or created hope where there was only darkness. Second, share your healing warrior moment. Whether you've been saved by someone else's courage to speak honestly about mental health or your own vulnerability has helped heal others, your story matters and could be the exact encouragement someone desperately needs right now. Mental health recovery happens through community, and every authentic story creates space for healing. Third, subscribe to Rainbow Spotlight for more celebrations of the heroes who prove that healing multiplies when shared authentically while creating communities where struggle doesn't have to mean suffering alone. We're building a space where mental health advocacy meets genuine community care, and every courageous story reminds us that seeking help is the bravest thing any warrior can do. These discussions remind us that whether mental health advocacy focuses on intersectional therapy, digital accessibility, crisis intervention, professional reform, or trauma-informed entertainment, the most transformative healing happens when people refuse to suffer in silence while creating communities where vulnerability is celebrated as courage and authentic healing becomes possible through genuine connection and mutual support. Don't forget, supporting LGBTQ plus mental health advocates, sharing resources that save lives, and staying committed to breaking the silence that kills really are what create the most meaningful recovery culture while ensuring that no one has to fight their mental health battles alone. Thanks for joining us on Rainbow Spotlight, where mental health warriors meet life-saving courage. And every authentic story of healing reminds us that vulnerability shared becomes strength multiplied, creating communities where seeking help becomes an act of love rather than admission of weakness. And every warrior who breaks the silence literally saves lives.